This is ITV. Certainly the best.
Good afternoon and welcome to the program Healthy Living. I am Ifoma Igwe. Now you know that it's all about our health, and we do say that a healthy nation is a wealthy nation, a healthy family is a wealthy family, hence the need for us to always do regular medical checkup, even if it's just once or twice a year, just to make sure that you are okay. And all the parts of our body are so important. Honestly, they are. If you think they're not, try to actually tie one part of your body and see if you can really function well. So you're welcome once again, but very quickly before we start our discourse today, let's quickly look at some of the news making the round. Our first point of call is Zimbabwe, where the World Health Organization has revoked the appointment of Zimbabwe's Robert Mugabe as a goodwill ambassador following a widespread outcry. Now, during the first 20 years of Mugabe's 37-year rule, Mr. Mugabe widely expanded health care, but the system has badly been affected by the collapse of the Zimbabwean economy since 2000. Staff often go without pay, medicines are in short supply, and Mr. Mugabe, who has outlived the average life expectancy in his country by 3 decades, traveled abroad for medical treatment. Now, Mr. Tadros said he had consulted with the Zimbabwean government and decided that residing Mr. Mugabe's position was in the best interest of the WHO. He said he remained firmly committed to working with all countries and their leaders to build universal health care. Mr. Tadros, elected in May under the slogan, "Let's prove the impossible is possible," had said he hoped Mr. Mugabe would use his goodwill ambassador role to influence his peers in the region. But the appointment was met by a wave of surprise and condemnation. The UK government, the Canadian Prime Minister, the Wellcome Trust and NCD Alliance, UN Watch, the World Health Foundation, Action Against Smoking, and Zimbabwe lawyers and social media users were among those who criticized the decision. Okay, and from there we'll move on to pollution, where pollution has been linked to 9 million deaths worldwide in 2015. A report in the Lancet has found almost all of these deaths occurred in low and middle income countries where pollution could account for up to a quarter of deaths. Bangladesh and Somalia were the worst affected. Air pollution had the biggest impact, accounting for 2/3 of deaths from pollution. Now, Brunei and Sweden have the lowest number of pollution-related deaths. Most of these deaths were caused by non-infectious diseases linked to pollution, such as heart disease, stroke, and lung cancer. And talking of cancer, British scientists have worked out how many changes it takes to transform a healthy cell into a cancer. The team at the Wellcome Trust Sanger Institute showed the answer was a tiny handful between 1 and 10 mutations depending on the type of tumor. It has been one of the most hotly debated issues in cancer science for decades. The findings published in the journal Cell could improve treatment for patients. Now, if you played sports, the difference between a cancer and healthy tissue, you could find tens of thousands of differences or mutations in the DNA. Some are driving the cancer's growth, while others are just along for the ride. So which ones are important? Finally, novelty contact lenses and eye risk. Eye experts are warning of the risk of wearing novelty contact lenses at Halloween, saying they can cause a nasty infection and scratches to the eyes. Cosmetic contact lenses are often sold in joke and fancy dress shops and on websites, but they come without instructions on safe use. Eye health professionals say novelty lenses should never be shared, stored in tap water, or kept in overnight. In extreme cases, this can lead to impaired vision and sight loss. The Association of Optometrists said its members often saw people with eye problems after wearing novelty contact lenses. Okay, and so that's exactly what we're talking today, but not contact lenses, generally eye care. And this is where I welcome my doctor today to the program, Dr. Rita Momo, consultant ophthalmologist. You're welcome to the program, ma'am.
Thank you very much. Thank you.
Okay, so eye care. Now, basically, let's look at our eyes. How important really is the eye?
Well, you can say that again. I'm sure everybody agrees that the eye is very important. It's that organ that observes the sense of sight, and that helps us to appreciate the world around us. And you know, as human beings, we are visual animals. You know, we respond a lot to visual stimuli. So the eyes are very important, and we'll do well to take care of the eyes. And indeed, if you also think about it from the aspect of learning, and you need your eyes to learn, especially children. You need your eyes to learn. You need your eyes to work. You need your eyes to appreciate so many things around you. So definitely the eyes are very important. So we really do need to take care of our eyes.
In taking care of our eyes, let's before we start taking care of our eyes, let's look at some of the infections that can affect our eyes.
Okay. Generally speaking, there are different kinds of infections that can affect the eye. You have the ones that can affect the anterior aspect of the eye, the outside of the eye, or what we call the ocular surface. Those ones are usually not too serious, in that they don't usually, if they are well taken care of, they shouldn't lead to blindness. You know, they are usually easy to take care of. Then you have infections that affect what we call the posterior segment of the eye. Those ones can be more serious, and they tend to lead to blindness more readily than the ones that, like I said, affecting the anterior segment and the ocular surface. The common infections that you would find are things like conjunctivitis. Conjunctivitis just means inflammation of the conjunctiva, which is a mucous membrane that covers the eye, apart from the central area, which is the cornea. And usually it can be caused by all kinds of organisms. It can be bacteria, it can be viral.
Conjunctivitis,
yes,
that's
the conjunctivitis.
The popular Apollo, right?
Well, Apollo is a type of conjunctivitis.
Okay.
Apollo is the type you call is a viral conjunctivitis. You know, I was telling you that conjunctivitis can be caused by different agents. You can have bacterial agents, you can have viral agents, you can have, it can even be chemical, you know, maybe chemical get into your eye. So there are different forms of conjunctivitis, but the thing about conjunctivitis, is just to, when you have the symptoms, which is redness, discomfort of the eye, tearing sometimes, and then if you have the infective ones like due to bacteria or even allergy, you may have what we call discharge. If it's the one that is allergic, you may have a kind of discharge that is not so purulent. It's kind of mucoid, whereas the one that is due to bacterial agents will be more purulent, to just be like pus, like milk coming out of your eye. So when you have such symptoms, you know, and discomfort, it's good to seek proper care. And proper care, I mean, you should present to an ophthalmologist or an eye care professional. If you cannot have access to an ophthalmologist, you can present to any eye care professional or general practitioner, or even the primary healthcare center workers. They will be able, an optometrist, they will be able to treat that condition readily. And so that is how it is for those simple infections. But the thing about those kind of infections like conjunctivitis or lead infection, what we call blepharitis, is that you usually will not have problem with your vision. They don't usually impair the vision, but they cause you discomfort. So you can easily try to sort them out by seeing the right eye care professional. Because even as much as we say that they are simple problems, if you do not treat them properly in the right way, they can progress to cause more serious problems. Okay? So it's important to see an eye care professional to treat your eyes, whatever it is. And of course, by the time you have complaints that involve not seeing well, your vision is deteriorating, and then you're having redness, maybe the same tearing and pain. If you're having pain of any sort, then of course you must see an ophthalmologist. You must see an ophthalmologist because you may have an eye condition that can readily progress to blindness. So it means that you need to see an ophthalmologist. Sometimes some of the eye problems that we are talking about that we have, they are not even obvious. That is, you may have eye problems and you do not even know that, you do not even know that you have eye problems. So apart from presenting when you have symptoms, we also encourage that at particular times of your lifetime, you should present for screening. You know, you should present for screening in an eye care facility. For example, there is a common eye condition that causes blindness, and that is glaucoma. Glaucoma is an eye disease that affects the optic nerve, and it causes progressive and irreversible blindness. And the sad thing about glaucoma is that you don't have warning signs. There's nothing to tell you that you're having an eye problem until it is almost too late. So because we know that glaucoma is like that, and we also know that glaucoma tends to occur with age. The older you get, the more likely it is you can have glaucoma if you have certain risk factors. So if you consider those risk factors, for example, if you're diabetic, if you're short-sighted, if you have a family history, if you already have somebody in your family who had glaucoma in the past, you know, such risk factors will make you want to seek an eye care professional early to screen if you have glaucoma, because it can be a blinding disease, and really by the time you are blind from glaucoma, you cannot really get the vision back. So it's a serious problem. So we encourage screening. And then we also find that conditions like presbyopia, when people are getting older, you find that they start having difficulty in reading small prints. It's actually more or less a physiological condition, which means it tends to happen to all of us as we get older, but in varying degrees. And maybe depending on on the way we use our eyes, we may not notice it. Some people may not notice it, especially if they are not learned. But if you're somebody that is learned and literate and you read you will notice that you have such complaints. And it's not a difficult problem to treat. We can readily test your eyes and find out the right glasses that you need to wear. And when you wear them, you find that you can see. You know, so that's generally it for common eye problems. Then in children, again, I want to talk about older children. I talked a bit about the younger children earlier on. Children also may have complaints. You know, some children will be in their classrooms, they cannot see well, they cannot see the blackboard well. Some of them, you find that when you give them assignments and things, it's a problem for them to read for a long time. They start tearing, or you notice that they're watching television and they're tearing or having difficulty in seeing clearly. You know, such children may have refractive errors, which means the eye, the focusing of the eye is a bit faulty. So they also would need to be examined, to do a refraction, do an eye test to find out the correct type of glasses for them to wear to help them to see. So that is it generally. So you have eye problems that are symptomatic. When they are symptomatic, which means they will give you one sign or the other. So you do well to come and see an eye doctor so that you will check them out. And then, like I said, there are many of them too that are not symptomatic. They may not show. I gave you a classical example, which is glaucoma. So because of that, we also advise that people should screen, especially as they get older. So from age 40, you screen. And when you screen, one may pick up that kind of disease. Even conditions such as diabetic retinopathy, which is associated with people who have long-standing diabetes mellitus. You know, the longer you have diabetes, the risk of having diabetic-related eye problem, just as you know, diabetes can affect other parts of your eye, of your body. You can have complications in the kidney, in your limbs, you know. So you can also have complication in your eye due to diabetes. So when you have such conditions, such systemic conditions, when you're diabetic, when you're hypertensive, it is good to always screen. You know, screen your eyes because they may cause problems that will not be obvious to you, but they will just be there. And one day, it may just become very severe and cause sudden blindness. So it's good to screen so that when such problems are there, they can easily be detected and then they will be treated.
Okay. Yeah. Doc, well, you've explained a lot, but how come we have a lot of children these days wearing glasses? Now, the glasses is for those with learned parents who knows that at this point, maybe this child, there's a problem, he or she is probably tearing, like tearing now, like shedding tears.
Yeah.
Always a lot of tears, and probably when reading or just always scrubbing the eye or something. But for those without parents like that who would want to see, or who has the time or patience to, you know, why do we have children like this, especially these days? Like there are much now.
Well, refractive errors is, like I said, it's been there. It's not really a new thing. Many children have refractive errors. You know, the way I explain refractive errors is that the way somebody is too tall or the way somebody is too short, the eyes can be like that. So it can result in a problem with your focusing things clearly. So if you consider that people are born tall and people are born short, you can imagine that.
So it has nothing to do with their mom.
No, I'll get to that. Sometimes it can be inherited. It can be due to inherited problems. Maybe the father or the mother or somewhere along the line in the family, refractive errors exist. So the children can also pick it up, can inherit it, and they will show up with that problem. But I think the reason why people tend to think that it's common now is because many parents, many of us are becoming more aware. We're more aware, and our children are going to school. Almost, I don't know where. There will still be children that are not going to school in some areas, but by and large, primary education is free for most children in the country. So when children go to school, such problems can easily be noticed, even by the teacher. The teacher can notice those problems and tell the parents, and then, you know, they can now advise them to go and see an eye doctor, and that person, and then they'll now find out that the child needs glasses. But the other problem I've noticed about children wearing glasses is that even when that happens, even when the child is eventually sent to an eye doctor to be screened and will find that the child needs glasses, many parents do not even allow their children to wear glasses. Wow. Yeah, they feel that glasses is bad for the eyes, that it will make the children look funny, or it will make the eyes get worse or something. They have all kinds of perceptions about wearing glasses. But I want to use this medium to encourage parents that wearing glasses is not a bad thing. It doesn't make the eye worse. It only corrects for a deficiency. You know, I keep using that same example. It's like you need to be a certain height for you to see something. And if you're too short, you can't miss it until you stand on a stand. You know, if you're too tall, you need to step down from your stand. So that is just what a reading aid is. It's just an aid. It helps you to achieve vision, to achieve good vision. It doesn't really have an effect on the eye. If there's a problem with the eye, there's a pathology with the eye, that is a different case. But in terms of children having refractive error and needing to wear glasses, there's really no disease of the eye. So the glasses is not going to make it worse. What usually happens is the fact that as children grow, the prescription, the eyes are growing. So the power of the eye may change. So you can find that the prescription they start out with may change along the line as they grow. Okay, so that is essentially what happens. But at a certain age, it tends to stabilize, and they're able to wear those glasses for a pretty long time at almost the same prescription. But they don't, glasses do not damage the eye. They don't damage the eye.
Of course.
Yes.
Now, still on that, on kids, I mean, is it, you know, I don't want to ask if it's hereditary, because I've actually seen a family where their dad had problem with his eyes.
Yeah.
It's just him. Amongst his siblings, he happened to be the only one with such eye problem. And his children, you get, having this, tearing. One of them already is on glasses, while the other one, they are planning on how to. And then you want to ask, I mean, where did it come from? How come your siblings don't? You are the one that are now your kids. How can that be explained?
Well, it's easy to explain it because, like I said, some of these things are hereditary, but being hereditary does not mean that everybody in the lineage of the family will inherit it. Most times, these conditions, they are inherited in a skip manner, which means that they tend to skip, they may skip generations, and they may, even within generations, they may skip individuals. It just depends on how the genes, you know, take up, you know, formation and express themselves in the individual. So it's not uncommon to find hereditary conditions in which not all members of the family are affected. So it's just the way the genes express themselves. Okay.
All right. Let's now look at some of the eye infections that are symptomatic.
Yes.
Yeah. You said some are non-symptomatic. Let's look at the ones that are symptomatic. I mean, at what point should someone worry that his or her eyes is diseased?
Yeah. Generally, I always look at it from the point of what will be happening to you that is unusual, that will make you uncomfortable enough to want to see a doctor. If you have eye pain, for instance, it's a symptom, so you should go and see a doctor because it's not usual for your eyes to be painful. If you have been seeing clearly and then you find that you're no longer seeing clearly, maybe your eyes the vision is blurry, or you find that you can't see things that are far, somebody has to come very close to you for you to see, or you find that you see people but you just notice that you can't see their faces very well, or you find that you're looking and it's kind of foggy. There are different ways that the deterioration in vision expresses itself. So when you notice that, you should know that it's not normal. So you should also want to seek eye care. So the major complaints that will make you want to seek pain, loss of vision, and then redness. Is not, your eyes are normally clear and white and nice like yours. So by the time you start to find that your eyes are red, most times when you have redness, there will be some element of discomfort, sometimes pain along with it.
Yeah.
So such conditions will also want to make you to seek eye care. And then such conditions may also be associated with other symptoms. You can have things like tearing, like you have mentioned, discharge, having discharge coming out of the eye, like I explained earlier. So these are all abnormal conditions. So when you have them, you want to seek eye care because something is definitely going on. Yeah, something is going wrong. So you need to seek eye care. And it's difficult to say, oh, when you have this, you have this disease. When you have this, you have this disease. It doesn't really work like that. You can have different combinations of symptoms and it will mean one disease. You can have almost the same combination of symptoms causing another disease. So I won't want to say, oh, when you have this, it means you're having this. You should know. So when you have generally symptoms that are deviate from normal, you should know that something is going wrong with your eyes. So you should come and seek eye care. Some people who have symptoms, and because of the kind of society we live in, you may just want to go to a quick fix solution place, anywhere that is easy for you to reach first. Some people will go to chemists, some people will go to maybe resort to home remedies or alternative medicine just to take care of that pain, just to take care of that redness or whatever they think is going on in the eyes. Our experience with such things, we have found that they're usually injurious. By the time you resort to self-help medication, maybe you want to use traditional eye medications like salt sugar solution, urine, leaf extract, all these things, they are very toxic to the eye. So they damage the eye. And by the time you now present to an eye facility, the damage is usually very bad. So we usually advise against the use of such self-medication. We don't advise. And then if you go to a chemist, I find that many people go to chemists. Chemists or pharmacies, they are primarily there to dispense drugs based on a doctor's prescription. But you know it doesn't work like that here. Many times you're sick, you just go to the pharmacy or the chemist man and say, look, I'm having this problem, give me a drug. And they will prescribe something to you based on what you have told them. But the thing to note is that if you are giving drugs and within 2-3 days you are not feeling better, you should make sure you see an eye care professional. Because some of the drugs that they will give you, because they don't have the opportunity or the knowledge to examine you and know what the problem is kind of guesswork. So when you start using such drugs, they may actually cause more problems for you, either in the short term or in the long term. So the best thing is, if you are that strapped for attention or cash and you have to just present in somewhere nearby, fine, do so, but make sure that if you're not getting better in 2-3 days, you should take time out and come and seek proper eye care.
Okay.
Yes.
So in seeking proper eye care, it's not just for you to go to any doctor you get, because that's why they have the eye doctors, we have the ear doctors, we have the teeth doctors, then we have the ear, nose and throat doctors, the ENTs. Then you have the eye doctor, which is very, very important. I mean, if you're having eye problem, you go and meet an ear, nose and throat doctor. What do you think he will do for you? You check your ear, nose and throat and say you are fine. But seriously, we should learn. It's about time we learn to go to the non-proper place. Like if you go to the University of any teaching hospital, they will tell you go to this place or go to that place, or you go to specialist hospital, you know, rather than, oh, I have a doctor somewhere. You know, some doctors are actually jack of all trades. You know, whatever you bring, of course, they can.
Okay,
always
I'll make a quick comment on that. That is usually a big problem. People don't know where to go, and you can't really blame them because there's so many people out there that claim to be this or that and treating this or that. And in a case of the eye, we actually have a spectrum of eye care personnel, eye care professionals. For example, we have the ophthalmologists. Ophthalmologists are medical doctors. They have been trained as medical doctors. And in addition, they have now specialized in the eyes. They specialize in the medical care of the eye, the surgical management of the eye, as well as the optical management of the eye and rehabilitation. So they're total and comprehensive set of professionals for eye care, and actually are the leaders in the eye care team. And then you have the optometrists. Optometrists too are eye doctors who have been trained in the university. They have a first degree, a doctor of optometry. So they are eye doctors, and they are trained also to look at the eye, to examine the eye. And although they specialize in prescription of spectacles and all that, they should also be able to examine and tell you the different types of eye problems that you have. The next thing is that if there is a problem that is not within their scope of practice, for example, if somebody has glaucoma or somebody has cataract, somebody has diabetic retinopathy or any other visually impairing eye disease, they would normally refer you to an ophthalmologist if you need to seek an ophthalmologist care. You know, but the problem is that sometimes you may be unfortunate to be in an environment where you don't have an ophthalmologist. Maybe they're not able to refer you, but I'm sure because they are trained, they also would know what to do. The people who are really not trained to look at the eyes per se may be purely optical technicians. They are not really trained to do eye examination for you, the optical technicians.
We call them opticians.
You call them opticians. But a general practitioner, a medical doctor, can examine your eyes because as they go through medical school, they have to do a posting in ophthalmology. So when they come for the posting, they are trained about the eyes and how to examine the eye and make the common eye condition, make the diagnosis of common eye conditions. And they will be able to tell you where to go at the very least. So if a medical doctor, just a general practitioner, you go there, you have an eye problem. If you cannot meet an ophthalmologist or see an optometrist and you go to a general practitioner, they will be able to tell you, oh, this is the kind of eye problem you have. You have to go and see an ophthalmologist, or this is the kind of eye problem you have. You should see an optometrist. So it's okay. Then nurses, ophthalmic nurses too are trained because we find that
you have ophthalmic nurses.
Yes, we have ophthalmic nurses. That's another cadre of the eye care group. They're also trained to look at the eyes and make diagnosis for common conditions, but they are also to refer. You know, there's always, if there's a need for referral, they should refer. If there are common and easy things that can be managed, they should manage, you know. And these days, I'm a public eye health ophthalmologist. We are also talking about training primary eye care workers, you know. We find that in the rural areas where there is no doctor, what do? They have the primary health centers there, and who manages them? Usually you find maybe a midwife or a community health worker that is managing such centers. So these days we are talking about training those people to at least administer what we call like first aid, be a first responder. If somebody has an eye injury, what are the first set of things you can do to stabilize the eye before you send away? And then we also teach them these days to be able to recognize what has to go immediately to an ophthalmologist, what can wait and still go to an eye care professional. So that is generally how it is right now in terms of the spectrum of professionals that look after the eyes. So it is true that many people may not know where to go, but I hope with this little explanation I've been able to enlighten some of our people.
Okay.
Yeah.
Well, now you know, it's always important to know where to go to. Ask. No one will kill you for asking. Seriously. Now, please, it's eye problem. Can I see a doctor of the eye at least? Then they will now refer you to, okay, go and see an ophthalmologist, or go and see not an optician now.
No. An ophthalmologist or an optometrist if you need to get glasses. Yeah.
Okay, it's that time again where you get to call in and ask your questions on the program. Our number will soon be on the screen, and that's 08024610789. Now, I'm not straining my eyes to look at that number. No, I think it's very, very okay, because I think even this year I've gone to check my eyes. I don't know about you, but that's something you should do all the time. So it's either you give us a call on that number, or you send us a WhatsApp message. And please, when doing that, turn down the volume of your TV set so the doctor can hear you and answer your question. Don't forget, my guest is a consultant ophthalmologist. And she's a Dr. Rita Momo. She actually rushed in here from the theater, so yes, we understand that. So, Doc, while we're expecting the calls now, let's look at some of the everyday activities around the eyes that can actually cause problem for us. Because no one wants to see, and all of a sudden you're not seeing again because of the simple things we do to our eyes ignorantly.
Okay. There are many things we do to our eyes, from the mundane things to the very serious things. The mundane things, I always will say, you can see a lot of people wear makeup, a lot of people wear eyelashes.
Yes, I understand.
A lot of people wear, yes. Well, these are mundane things that we do, almost everyday things. And all we need to keep in mind or bear in mind is to be hygienic about them. There's nothing wrong with wearing makeup or using eyelashes. Just make sure that you do it in a very hygienic way. You don't share your makeup and things like that. And then you even did a little clip about contact lenses.
Yes.
Yes, you wear contact lenses, you make well to clean them properly as advised. You have to clean them every day, remove them and clean them every day, except of course you are wearing the extended wear ones, which you may be able to wear for a week or two or even longer depending. So if you stick to the rules, and nobody will give you contact lenses without advising you on how to look after them and how to look after your eyes. And but the ones we use for makeup, they're supposed to be disposable. They're supposed to be, you use them daily and then you dispose of them. Or if it's the one that is going to, you can use again, there must be a solution in which you can store them and then wash your hands and all that before you wear them. So if we generally adhere to these hygiene tips, we can keep our eyes safe.
Okay, we have a caller on the line. Hello. Good afternoon. What's your name, please? What's your name? Hello. Okay, where are you calling from? Okay, so go ahead. We can't make out what you're saying.
Repeat.
Repeat what you said, please. Hello? The only thing I heard so far is how can I get a doctor's number?
Oh, okay.
That's just about the only thing I heard. But I don't know if it said any other thing. So please, while calling us, make sure that you talk out loud so we can hear what you are saying. So don't forget again, the number is right there, 080-2461-0789. Go ahead, Doc.
Yeah. So we've talked about the mundane things that we do. The other things that we do that can be very serious and injurious to our eyes is how we handle our eyes when we have complaints. I've already talked a bit about that. One of the things that people do is that if they have an...
Excuse me, Doc. Hello, good afternoon.
Hello, Precious.
Precious, where are you calling from?
I'm coming from Apple.
Welcome to the program.
My eye, sometimes tears will be coming out of my eye.
When you are doing what?
When I'm doing nothing.
Okay. You want to ask her a question?
How old are you?
Eh?
How old are you?
10.
You are 10. Okay. Do you read a lot?
No.
You don't. Okay. Do you have any pain?
Yes.
You do. Okay. You know, like I said earlier on the program, that it's not easy to say because you have tearing, because you have pain or you do not have pain, you have this problem. The best thing you have to do is to go to an eye doctor. You should go and visit an ophthalmologist if you have one in your area. If you do not have one, look for an eye clinic where there's an eye doctor, an optometrist. So if you have any of these people, you can go there and let them check your eyes so that they can tell you what the problem is. Okay?
Hello? Hello? Hello, good afternoon.
Hello?
Good afternoon.
Hello?
Hello, good afternoon. We can hear you. Okay, I guess he's not hearing us. Hello, good afternoon.
Hello?
Good afternoon.
Good afternoon.
What's your name, please?
I'm Mrs. Kennedy.
Where are you calling from?
Coming from Benin.
Okay, you're welcome to the program. Go on.
Yeah.
Hello, Kennedy.
Hello?
Go ahead now. We're listening. Okay, give us a call back when you're ready. Hello, good afternoon.
Hello?
Good afternoon.
Good afternoon. Good
What?
afternoon.
Yeah, what's your name, please?
I think it's the same person.
Hello?
Hello, good afternoon.
Good afternoon. What's your name?
I'm Elizabeth Granima.
Where are you calling from?
I'm calling from Benin.
Okay, can you step away from your TV set?
Okay?
Or you turn down the volume?
Are you hearing me clearly now?
Yes, go ahead.
My own is, I normally have pain when I touch my eyes. Okay, like this contact lens, I'm not wearing it. So what should I do about that? That's all right. He said I should come back, but now I'm in Benin. I know the doctor in Ibadan, but I'm in Benin now. I don't know where to go to. That's why I'm asking.
Okay.
Repeat the question. Repeat it.
Okay, she said when she scratched her eyes, that her eyes is always paining her. She's been to a doctor in Ibadan, but now she's in Benin. So where can she go to?
Well, you should see an eye specialist, like I said. If you're in Benin, you can visit the public hospitals, any of the public hospitals. The University of Benin Teaching Hospital is in Benin. You can come to the eye department there, and you'll see somebody that will examine your eye. You can also go to the Stella Obasanjo Hospital in Sapele Road, I think. So those are the two major eye hospitals I know in Benin. And of course, there are many private eye clinics. I don't want to start mentioning the names of private eye clinics. No, yes, so I can't do that. So, but the major government hospitals, I know that is safe.
None in specialists.
No, the specialist one is not in Stella Obasanjo.
Oh,
yeah.
Okay.
The eye department in the state is in Stella Obasanjo Hospital on Sapele Road.
Okay.
Yes.
Hello, good afternoon. Hello. Okay, just one more call before we go on the program. Not forgetting that Doc is still telling us some of those things that we ordinarily do to our eye that can cause problems for us. Hello, good afternoon. Hello? Turn down the volume on your TV set, please. Hello?
Hello, madam.
Good afternoon.
Yes, Kodiak, my name.
Okay, you're welcome to the program.
Thank you. I have a problem. My eyes, it will be like, say, spider web. There for my eyes. When I turn eyes, it will drift to the left. If I turn to the right, it will drift to the right. I went to hospital and they did something, but it's not working. So I'm confused.
Well, the complaint you have just talked about is not uncommon. People have that kind of complaint, and it can be due to a number of causes. There are about 3 to 4 reasons why you may have that complaint. So again, one will need to know exactly what is going on. You know, sometimes if you've had problems in the eye, you've had inflammation, it can leave some scar tissue inside the eye, and you may have such a complaint that we call it a nuisance. It may not really go away. Sometimes it can be a symptom or a sign of a new problem, something that is just going on in your eye. And it is when we know and examine the eye that we can determine the kind of treatment to offer you. So I really would not know which category you fall into now, because I'm not seeing the eye. So again, you should just do well to see an ophthalmologist. Like I said, you can come to the University of Benin Teaching Hospital, or you can come to the Stella Obasanjo Hospital. And even now, the University of Benin Teaching Hospital, they have a community outreach place at Egba PHC Center on your way to what do you call that? Ikobauka local government area. Okay. Idogbo, on your way to Idogbo, after Ugbekun. There's a community eye service, eye care service in that PHC, Egba PHC. So just to reach out to members of the public as much as possible, the UBTH also has that service.
Okay, from our WhatsApp portal, I have this one. Hey, please, Doc, why do I have reddish eyes? Is it a good or bad thing, and how can I stop it?
Well, redness is a common symptom to so many diseases. It's a common symptom to so many diseases. When you tend to have, from what you are saying now, it looks like you've had long-standing redness. It's good to find out why. Some people just have eyes that are not naturally not quite white. They're kind of discolored, reddish. And then some people maybe long-standing allergy. The conjunctiva can get discolored and look a bit reddish. Sometimes it can be due to smoking, you know, substance abuse, and you can have redness of the eye. Okay. But most times it is actually just due to a frank inflammation of the eye, either an ocular surface inflammation or a deep inflammation of the eye. So it's difficult to say why you would maybe having redness. So the best thing is for you to also see an ophthalmologist, so that if it is a benign cause, if it's nothing for you to worry about, you'll be reassured. And then there are some remedies you can be given that can help you to reduce the redness.
Okay. Okay, okay, we don't have time again. Some people say that when your eye itches, you can add salt and water, put it in the eye. Is it okay?
From what I said earlier on, and I'll repeat it, it is not okay. It's not okay to put salt and water, sugar and water, or whatever into your eye, as long as it's not a properly prepared eye medication. Eye medications are prepared under the very strict hygienic conditions, because the eye abhors germs. So you don't want to use anything that you're not sure of how it is prepared and put in the eye. The only condition where we allow you to use water in the eye is if you have a burn. If acid gets into your eye, alkali gets into your eye, or something hot, or any chemical or spirit gets into your eye, you are allowed to use tap water to irrigate your eye, to rinse your eye for as long as possible, for up to 30 minutes. But right after that, you must be presenting in an eye facility, so that treatment can be undertaken.
Okay.
Yeah.
All right. Thank you so much, Doc. We must have to go now.
Yeah.
And I want to thank you so much for coming on the program today. We hope you do so on radio.
Okay, no problem. Thank you.
Okay, I've been speaking with Dr. Rita Momo. She's a consultant ophthalmologist. And of course, she's told us how and what we shouldn't do to our eyes, and the best way to take care of our eyes. Remember that your eyes, I don't need to tell you how important your eyes is to you. So we need to take very good care of our eyes. That's our program today. Thank you so much for watching. I am Ifoma Igwe. Bye for now.